Up. Okay. Welcome to our talk tonight. Tonight, before we get started, a couple things for those of you guys that are watching online and those of you here. We've done this before with, normally when we'd have bigger audiences, we'd put everyone's name and then we draw for either a supplement or two. So tonight, the supplements prizes, so if you like, comment, share video tonight, we're going to put everyone who does that online. We're going to write down names and then the people here. One will be CoQ10 for energy production, and then our other is fruits and greens. And then the other thing that we're giving away, Dr. Bouch and me, we're going to be giving away a free half-an-hour consultation, nutritional consult, and those will be on Tuesdays or Thursdays. So like, comment, and share on that. So for our talk tonight, kind of a synopsis of the last couple of talks. We've been talking about upper extremity and lower extremity injuries. Tonight we're going to be talking about, so now that you have an injury, how can we really speed up that? Oh, we got one more person coming in here. Come on in. We got a chair right over here for you. All right. So tonight I'm going to start with just a synopsis of just our last two talks. So we talked about how many different surgeries we have, and these are more the serious surgeries. So your rotator cuff, as far as extremities go, rotator cuff surgeries, 200,000 a year, 200,000 carpal tunnel surgeries, 600,000 knee surgeries, and 350 to 450,000 hip surgeries a year. And those don't even include your typical sprain strain. In fact, even this past weekend, I was golfing with two buddies of mine, and a friend of ours had a bad golf hole, and he took his ball and went to chuck it into the woods, and he pulled his groin. So when you're younger, you can roll down the stairs, you're fine, and when you reach our age, you throw a golf ball or you sleep wrong, and you're hurting the rest of the day. So today we'll be talking more so from those sprain strains, hopefully before you get to that point of needing surgery. So as we started off the last couple, what controls the body? And that's the nervous system. So your brain and spinal cord, your central nervous system, the connection to everything comes right from your spine. This is one of the reasons with a lot of our talks, we start out with posture so often. In fact, when we've talked about the nervous system before, if you look at all the nerves that come out, they go to all the organs in the front too. So even, and I remember back when I was in high school, when I got done with a race and track, they would never have us, boy, you just finished a race, bend over like this. They would have us try to lean back like this. A, it opens up the lungs. B, it's going to actually take pressure off the nerves that go to those organs. So we always like to start with the spine first. So posture. From the last talk, we had talked a little bit about degenerative disc disease. And what we always hear when we have a patient come in, say if they're brand new, they're in their 50s, 60s, 70s, and they just hurt their back or neck. And then we see a spine like this, and they tell us, well, it's old age. And I'll always go back to, well, these discs up here that look like they're from a 20-year-old, did you get new discs put in? No, those are the same age. So it's not technically old age, it's where you've had more dysfunction for a longer period of time. Going back to the nervous system, most of the nerves have nothing to do with pain. Only 10 to 18% of nerves control pain. So this process, just like you can have high blood pressure, high cholesterol, just like you can have big nasty disease like cardiovascular and cancer, it can progress for years, if not decades, before you ever get your first symptom. We talked a little bit about how that progresses. So if we look at our upper back and neck, in fact, if you look at what a normal neck curve is, this is something we usually don't see with our young adults anymore. In fact, it's much more common to see this phase one, what we call military neck, or I would say even reversed over tech's neck. It's becoming way more common. Our pillows are too thick for the kids. And then even if you go to a big box store, watch how many people are walking around in this slumped posture. We give kids iPads and iPhones at 5, 6, 7 years old. And over time, that just puts more and more pressure eventually on the disc between the vertebrae and then eventually onto the nerve roots. Eventually, once you get down here to this phase 3, you get to a certain standpoint where it's going to be very difficult to actually reverse that. So we talked a little bit about prevention. The only thing I'll mention tonight is your body ready for activity and proper diet and nutrition. So if you played for a sports team, say the Green Bay Packers, and you didn't practice at all and you went out to go play your first game, potentially like Aaron Rodgers is going to play his first game, is your body actually ready for activity? So part of preventing injury or treating injury is how ready are you before whatever activity you're going to do. Since tonight's talk is about speeding up healing after an injury, let's take one of the most common injuries that we see, an inversion sprain of the ankle, where you roll your ankle outside. So before I bring up my next slide, one of the most common ligaments that gets torn right here, does anyone know what ligament that is? It's in the front outside of the foot. This is your talus joint. This is your fibula. Any guesses? Big guy in the back. Anterior talofibular ligament, one of the most common things that we see sprained. Okay. And so if you look at a ligament is what connects a bone to a bone, a tendon is what connects a muscle to a bone. And if you look really close at this, it's kind of a whitish, almost like if you look at a T-bone steak. So before you grill it, the meat part is red and then you have the bone, but right where it connects that tendon, it's white. Well, it's white because it has a poor blood supply, and poor blood supply equals slower healing times. Just a quick update on what is a sprain versus a strain. Strain involves a muscle and tendon, and a sprain is a ligament, which connects a bone to a bone. So our last two talks we had talked about, so you injured your ankle. What can I do right away to try and get back in the game, so to say? So I like the acronym PRICE. So we're going to protect, rest, ice, compress, elevate. So number one, if I've hurt something like a sprained ankle, even though motion is really good to help speed up, well, if I run on a sprained ankle too early, I'm going to prolong the damage. So number one, we're going to protect it. We're going to rest it, we're going to ice, we're going to compress, and we're going to elevate. Going down, you'll notice at the bottom mobilization. So, and Dr. Bouch has used the story multiple times with healing, especially back in the 80s, some of the different injuries. We found that, boy, if we start moving extremities right after a surgery, that it actually speeds up healing. So we're going to try to mobilize as quickly as possible. And what we're finding more and more, I have to put a tendon ligament under some sort of strain to actually start to get collagen fibers to realign. The sooner I can do that, the better. But obviously, we're always going to talk about avoid anything that causes sharp pain. How long does it take to heal? Well, just as I mentioned earlier, only 10 to 18% of nerves transmit pain. So high blood sugar, cholesterol, arthritis, heart disease, even cavities. Even when I see my dentist twice a year, there's been times where he says, oh, looks like we have a cavity, and he takes a picture, even though I don't have any pain. So by the time you have symptoms, it may have progressed for a while. Healing of ligaments and tendons can take weeks to years. So next two slides, just talk a little bit about wound healing, and you'll see different time frames. So inflammation, we usually say 72 hours. That can last up to 10 days. Proliferation repair, and this they say 4 to 24 days. Some studies will say up to 6 to 8 weeks. And then finally remodeling, 3 weeks to 2 years. So it takes a long period of time to actually heal a joint, ligament, tendon. Just a little bit more in depth as far as the soft tissue healing process. So I'm going to go into my next few slides as far as what you can do to support each stage. So right away you sprain an ankle, it swells up. Yep, we can tell inflammation, and acute inflammation is good. In fact, if you didn't inflame after you injured a joint, it would never heal. What we don't want is chronic inflammation, and unfortunately our diet is definitely predisposes people to chronic inflammation. The repair phase, this is what's going to take usually weeks to a couple months, and then finally the last stage, remodeling, and that's where so let's say I sprained an ankle or even a wrist. The more I can start to get that joint to move through all the ranges of motion as quickly as possible, the sooner that it's going to heal. The worst thing would be almost like if I sprain a joint and then I just immobilize it for a long period of time. Well, eventually if I get scar tissue in there, and if I get calcium and a number of things in there, well, I might completely lose range of motion in there. So the sooner I can get motion, the better. So how do we support each stage? I thought this was kind of a funny, different sport. So a blister, 2 to 3 weeks. Finger jam in the NBA, 2 to 4 weeks. Toe turf, 4 to 6 weeks in the NFL. And slap shot to the face, hockey. So I have from the Wausau West hockey tournament, golf tournament here a couple weeks ago, my bracelet. I remember doing a hockey game one time, and I was doing sideline work and a guy had taken a stick to the face. Well, by the time I got over, he was already off the ice and the coach was like, no, he just took a stick to the face. He's fine. So different sports, different healing. So what can I do nutritionally to help? And a lot of our talks, we always kind of go back to those 4 essentials. So even when you look at all the different supplements and things on the market, there's 4 essentials that your body needs. And by essential means your body can't produce it, it's got to intake it. Okay? And those include vitamins, minerals, amino acids or protein, and fatty acids, things like fish oil. We always tell people eat real food and avoid carbonated beverages, especially if instead of a Sprain strain, a full out break, the last thing that you want to do is have a couple of Cokes a day. Okay?
Can I ask a question?
Yeah.
So even things like sparkling spring water, that
Yep.
should be avoided?
So generally I'm going to try to avoid anything carbonated right after.
And why is that?
So anytime I have things that are carbonated, I'm going to have to buffer it. And what do I buffer it with? I buffer it with minerals. And so if I'm trying to heal, let's say, a broken bone, the last thing that I want to do is take something that's going to cause my body to help buffer it with things like calcium, bicarbonate, and magnesium. Generally, though, if I had to go on, should I avoid, what would be better on a hierarchy between, say, a Coke or Diet Coke or a LaCroix? Yeah, I would want to have a LaCroix.
Okay, so I don't understand what you mean about your body having to buffer it, and I don't understand why carbonated beverages would cause that to happen.
Yeah, so if I look at, say, my bones, so if I take in anything, my body, my stomach acid has to be low enough. And then if my stomach acid is low enough, meaning I don't have acid reflux, then when I'm taking in minerals and things like that, I'm going to help absorb it. If I don't have enough minerals that I'm taking in, so I'm not eating enough fruits, vegetables, things like that, and I'm having more things that are carbonated, it just means my body has to use minerals from the body to help buffer that. So I believe it was the University of Madison, they found that if a person had 2 Cokes a day or 2 Pops a day, after a break, they were 50% more likely to re-break.
Okay, I'm sorry, I don't mean to beat a dead horse here, but why do carbonated, I don't understand why carbonated water would cause that problem.
I can just real quick. So your blood has to stay at a certain pH, and if your blood doesn't stay at that pH, so when you talk about buffering, it buffers your blood. So when you drink something carbonated, you have to take calcium out of your system to keep the blood at the normal level. So he's right. University of Wisconsin-Madison, they looked at the studies that if you looked at who healed and who didn't heal, a carbonated beverage robbed calcium, made it took it from the bone, so it didn't heal as well. So your body has a pH that's like a acid or base. It has a really fine ratio. If you are eating things that are real basic, it will steal calcium to balance that out. So carbonation steals calcium, both absorbing and makes your blood steal calcium. And when it does that, the fracture won't heal as well, or you get osteoporosis. So the leading osteoporosis doctor in the world is at UW-Madison, and he said the number one thing with a fracture or osteoporosis, the first thing people should do is not have carbonated beverages, because carbonated beverages are bicarbonate. The only way you can make it not a bicarbonate is to add calcium to buffer it.
So hopefully you guys could hear that online, but it has to deal with as far as buffering goes. And so, yeah, blood pH normally has to stay around that 7.35 pH, so it's slightly alkaline. It doesn't change by a whole lot, so your body does a really good job of helping buffering that. Unfortunately, it sacrifices the bones to do that. So, good question, though. I always like questions. In fact, I like questions more often from patients when I do get stumped, because it allows me to educate myself, too. So, good question. Just on that, vitamins and minerals, does anyone know the difference between a vitamin and a mineral? A vitamin is something that can be broken down by light and heat. And so your minerals are things like calcium and magnesium, and your vitamins are going to be things that, so if I have a whole food supplement and vitamin, I don't want that ideally exposed to light and oxygen and that, and I try to keep it in a cool, dark spot. Good question. Okay, so how do we support those stages we just talked about? Number 1, inflammation. Okay. We're typically going to ice, so let's say a sprained ankle, I like ice buckets. We're going to ice 15 minutes out of every hour, and we're going to really concentrate on anti-inflammatory foods, especially within that first week. Okay, So no McDonald's, lots of deep leafy greens.
What are anti-inflammatory foods?
Excellent question. So anti-inflammatory foods are going to be things like your fruits and vegetables, your deep leafy greens. Things that are going to be pro-inflammatory are all your processed foods, things that are more acidic. So if you look at an alkaline versus acidic foods, sometimes even a ton of your red meats and that can be more acidic. So things that are anti-inflammatory include also things like fish oil and turmeric and cod liver oil. So if I broke it down, just eat real food. If I eat things that are processed, they're going to be more inflammatory. And you can actually test these. I get tested usually, if not every year, every other year, like C-reactive protein with your medical doctor. That's a way to test chronic inflammation. Also omega-6 to omega-3 tests. So I get a blood test usually every 1 to 2 years, and that'll actually tell you what your inflammatory profile is. Okay. Now there's also other anti-inflammatory medications. Obviously some people do things like NSAIDs, so non-steroidal anti-inflammatories, things like Advil and Aleve.
Quick question about food, unless you're going to get back to doing food later.
I'm going to go through a couple of different examples, but
Okay, just a quick question. I made some spaghetti sauce tonight, and I'm at the store and I'm going, whole grain? Or, am I saying that right? Whole grain spaghetti or whole wheat?
boy, whole grain versus whole wheat.
So I did whole grain.
So
And maybe we'll get to that later. So
yeah, I mean, most of your grains and that, if I can do grains, I'm going to do your sprouted grains. I'm going to do things that are lower on the glycemic index. I guess the difference between whole wheat and whole grain, I honestly don't know the difference.
like in a noodle,
Yep.
which one would be better?
Boy, I'm going to do something that's, the lower the glycemic. I guess I haven't bought spaghetti in years, so I wouldn't even know what to look for. Dr. Bouch, would you have any idea on?
I mean, it could be just a spoof on words, it could mean the same thing, or it could be a wheat-only product, or a whole grain could have other types of grains in it. And so, again, I'm guessing it's a little bit of a spoof on words. The best thing to do is look for non-grain pastas or non-grain things that you could use, and there's a lot of alternatives now.
Kind of where we,
Oh, okay.
yeah, so we even see, I tried to make for the first time zucchini noodles. I used one of those things where you, like a juicer, and it turned out terrible. I guess.
Spiralizer.
Yep, you need a spiralizer. So you have that, and you have cauliflower pizza. So you have more, non-grain alternatives. But these are good questions tonight. People online like, man, he's been getting stumped here. This is good. This is typically what we'll use as far as acute support. So if we have an injury right away, so ligament, ligaplex. So these are two of the products that I'll use with some of the athletes or, friend that just got hurt. Vascuzyme is a multi-enzyme formula. Okay. This a little bit more and I wish this turned out just a little bit clearer, but and I've done this before on a talk just on fish oil. So fish oil is anti-inflammatory. There's one part of it. It's called EPA, eicosapentaenoic acid. And when you look at a really good quality fish oil, and I actually just screenshotted what ours are made from, this one right here, so almost a gram. So if you look at the big horse pills, it's about 1,000 milligrams or a gram. And if you look at the majority of it, it's EPA, and that's what works as an anti-inflammatory. And DHA is the other component. DHA is what helps the brain. It'll actually tell you what the components are. If I get a really cheap fish oil, it'll just give you asterisks. It won't actually tell you how much you're getting.
If you eat fish 2 or 3 times a week, do you still need to supplement with fish oil?
Well, as I've been told by my naturopath, test, don't guess. But if I'm doing wild-caught salmon, things like that, and I don't do a bunch of fast foods, things like that, I should be fine. But the only way to truly test that, you do a blood spot test. So you can actually, we do a test here, and I do it, like I say, every 1 to 2 years. I usually, since your red blood cells usually replace themselves every 120 days, I like to do something for 4 to 6 months and then get it tested. Because then I can find out, am I taking too much, too little, or just right? And so, you can actually test to see, hey, I've been taking this supplement for this long, or let's say I don't supplement, I eat fish this many times. Then you can actually see, hey, am I getting enough? So the only way truly to tell that is to test your blood.
Well, what would your expectation be if you're eating wild-caught salmon?
If you're eating,
tuna, good tuna?
Yep. If you're eating wild-caught salmon and you're doing more of a Mediterranean-type diet every week, I always tell patients, ideally supplements are meant to supplement the diet, not replace. Ideally, you wouldn't take any supplements whatsoever. So yeah, if I lived in the Philippines and ate wild-caught fish in that every day, yeah, I wouldn't have to supplement. Good question. We did not pay this lady to come in here and ask questions. Okay, to support the last two stages, repair, proliferation, and remodeling, actually a good segue. So Mediterranean diet is a good starting spot, and then you can tweak it as need be. Some people get away with more fats. Some people can actually get away with more grains than that. Speaking of grains, there was a book called Healthy Gut, Healthy You I read a couple of years ago. And it was kind of neat. One of the take-home messages was if you go back 10 to 20 generations, the closer to the equator your ancestors are from, generally the better you do with grains. And the further you get away from that, so if you're more Scandinavian, I'm mainly Finnish and Swedish, the worse you do with grains. So like if I go to Subway and have a sandwich, I'm taking a siesta, I'm taking a nap. But I do really good with fats and meats. But a Mediterranean diet is a good place to start. As we had mentioned, repair, proliferation, and remodeling, 6 weeks to 2 years. So after you injure a joint, yeah, it's going to take a while to heal. So ideally, you would eat good forever. People talk about, well, diets don't work. Well, yeah, diets don't work, but lifestyle changes do. So if you eat healthy throughout the rest of your life, you really don't have to worry about it. Adequate protein. So even going back to bones and calcium, and as we had talked about, normally when we think bones, we think calcium. Bones are primarily made of protein. Calcium is just one component. So let's say you don't have enough amino acids, enough good proteins in the diet. You're actually more predisposed to things like osteoporosis. So we'll say like 0.5 gram to 1 gram per pound of body weight, depending on what your needs are, which sounds like a lot, and that's of lean protein. So ideally, I would be having at least 100 grams of protein a day. And what I do right now to supplement my diet, if I'm not eating a bunch of protein, I just do some pea protein at night. Actually helps me sleep. Last is a multivitamin. So you look at all the different trace nutrients you need to build healthy collagen, collagen, ligaments, tendons. A multi is just an insurance policy against an inadequate diet. Long-term support, and I'm going to get in just a little bit like I did last time with collagen, but ligaplets, ligament, this has a couple of different trace nutrients that help support long-term healing of the joints. To get into collagen a little bit, I always kind of laugh a little bit. I had a patient asking about this. Hey, my girlfriend loves collagen. I'm like, oh, she sprained a joint? No, it's great for her hair. So, yeah, we're cosmetically driven. So if you look at the different types of collagen out there, there's three main types, type 1, 2, and 3. Type 1 is your hair, skin, and nails. So that's why on Amazon, 2 of the top selling supplements are collagen. You can actually make your own collagen. Well, your body makes your own collagen if you give it what it needs. But also things like bone broths. So if I go to get some beef bones or chicken or that, especially if it's from a wild caught, or not wild caught, but pasture raised, grass fed, you can actually make, and I usually do this in the winter, 24 to 40 hours in a crock pot filled with water. And then the broth is really high in collagen. So these are the different collagen types. We have type 1, 2, and 3. Type 1 is that cosmetic, hair, skin, and nails. Type 2, really important for discs. So people with degenerated discs and disc bulges. Type 3 is muscle fibers, organs, livers, kidneys. In fact, new blood vessels, so you get a scar in that. Usually that starts as type 3.
Where does type 2 come from?
Type 2, so all these different things, tendons, all these come from, if I'm eating, say, a chicken or that, what do we normally eat? We eat the meat. Ideally, we'd eat the knuckles and all that stuff, and we'd make a broth out of it and actually get the bones to break down. So
what if you're a pescatarian?
Pescatarian, so you can't eat
Just fish.
So in that case, you could supplement with it. And there's a couple things I'm actually going to get into a future slide as far as how you can create, because keep in mind, your body can actually make its own collagen. Okay, just as long as you have a couple of different proteins and vitamins and minerals. Primarily glycine, proline, hydroxyproline amino acids. Okay, so these are things, and by non-essential, essential, conditionally, so these are things your body can't make on its own. You have to ingest it. So like this morning, I took a phenylalanine supplement because that really gets depleted if you drink too much coffee. which I've found I'm starting to get to my limit where I've had too much coffee, so I do a little extra phenylalanine. But as long as you have these amino acids, vitamin C, zinc, and copper, so let's say you're a pescatarian, yeah, if I supplemented with a pea protein, so I use like it's called less naked pea protein, and pea, the only thing it's short in is it's a little bit low in methionine, which can be a supplement. So in your case, boy, you might want to take a quality multi to cover these, maybe a little extra vitamin C, and then something like a pea protein, and you should be fine. Okay. Really good questions tonight. I do like these. Last thing as far as speeding up healing, and we'll get into Dr. Matt and Dr. Bouch. Movement without pain. We had talked about how can I get that joint moving as quickly as possible. Things like cold laser and then proper loading of ligaments and tendons. I'll bring up Dr. Matt.
So bone broth would cover all three of those colors.
Yeah.
2 and 3.
Yeah.
And you can probably get it pre-made down.
Yep. And I forget the ratios of the type 1, 2, 3 because everyone's going to be a little bit different.
Yeah, but
Yep.
if you do bone broth, it should really cover.
It should. Yep.
Your bone broth on Amazon, you get it so many places.